Well, welcome everyone to our program, a virtual town hall, colorectal cancer in the time of COVID-19. I'd like to just go around and introduce everyone and then get started with the webinar.
ColonTown is a online international community of about 5,000, more than 5,000 CRC patients and caregivers around the world. And really our main goal is to empower patients.
I'm Erica Terry. I'm CEO of Susan G. Komen, Kansas and Western Missouri. I represent an affiliate service area of about 117 counties.
Some of you listening know breastcancer.org has been around for 20 years. We are the leading digital source of information and support for women who are going through breast cancer in the here and now, to really be able to get the information and the peer support that they need to really navigate this very difficult situation.
What are you doing right now as an organization to be a resource for people impacted with colorectal cancer?
So we have this crisis financial aid fund for patients in treatment who can apply now. We have a coronavirus webpage on ccalliance.org where we are updating information daily. We send a patient newsletter that has access to all of the information that you would need.
My name is Reshma Matani. I'm at the University of Miami Sylvester Cancer Center.
Al Burstein from Dana-Farber Cancer Institute in Boston, and a medical oncologist specializing in breast cancer.
I'm Hope Rugo from the University of California, San Francisco. You can see the Golden Gate Bridge behind me in my virtual background. And I'm a breast medical oncologist focusing on clinical and translational research and patient care at the University of California, San Francisco's Comprehensive Cancer Center.
What types of things have changed in your day-to-day practice of medicine, both maybe for the good and for the challenging?
It's a new normal, but at the same time, it's still the same algorithm and keeping it running. And our patients, our family members, our institute, our colleagues, at a time of crisis, everyone bonds together. It really is a community getting patients through this, and you really do see that at times like this.
What does it feel like from your seat to do a telemedical visit?
This is an opportunity where we can provide the right care to patients in a way that's more convenient to them once we get back to normal.
My name is Danny Haber, and I'm the Chief Medical Officer for Pfizer Oncology. We are working to develop an investigational antiviral compound to treat COVID-19 and are evaluating other therapies that have scientific potential to help infected patients fight the virus.
Natera really is a group of clinicians, scientists, researchers, as well as our talented laboratory staff, really kind of all around the world, who really come together towards a common goal, and that's improving how genetic diseases are managed. Natera has a lot of utility to identify patients who may have disease that may be molecularly recurring, to really try to identify patients who may be at high risk of recurrence.
I've been on Ibrance now for about 2 years. I was diagnosed about 2 years ago. I'm under the care of Dr. Matani, and I am so grateful. Dealing with COVID has really kind of affected and somewhat isolated me even more.
Again, my name is Angela Gangler. I've been living with stage 4 colon cancer since 2015 with active disease. They asked me to delay my scans till May 1st. And that would have been pushing my surveillance scans past another month, and I wasn't really comfortable doing that. But right away he said, well, let's order mobile Signatera. So you can have your scan or your liquid biopsy drawn from home.
How do you recommend people, just in general, stay connected when we feel so disconnected?
My care team is kind enough to give me their cell phone numbers and all those crazy things. So we stay very connected.
I think just letting them know, even if it's out loud, that you are you're with them and you're here, and you wish you could give them that in-person hug, but you're very much with people through these times. So
how can a patient watching right now get involved with some level of patient advocacy in their community?
We have a really strong grassroots program, as well as I kind of emphasize the importance of being involved in public policy to help influence broad sweeping changes.
So again, I thank you so much, and I look forward to when we're all together again.
Thank you.
Thank you. Be well.